thyroid cancer is actually one of the most rapidly increasing cancers in terms of diagnosis worldwide. And here's the kicker. Many people don't realize they have it until they notice a small lump in their neck, or sometimes they find out by accident on a scan done for something else. So first things first, what is thyroid cancer? Well, the thyroid is a butterfly-shaped gland that sits right in the front of your neck, just below the Adam's apple. Its job is to make hormones called T3 and T4. These hormones are like the body's energy regulators. They control how fast your metabolism runs, how much energy you have, and even how your brain and muscles function. Now, thyroid cancer happens when cells in the thyroid start growing out of control. Like any cancer, it's basically the body's normal system of cell growth and repair gone rogue. Instead of stopping when they should, these cells keep dividing, forming a mass called a tumor. Some of these tumors are slow-growing and not very dangerous, while others can spread quickly to lymph nodes or even distant organs. That's why it's so important to know the signs early. Alright, so what are the main types? There are 4 big ones. Papillary thyroid cancer, which is by far the most common and generally grows slowly. Follicular thyroid cancer, the second most common, which can sometimes spread through the bloodstream. Medullary thyroid cancer, which is rarer and can be linked to genetic conditions. And then there's anaplastic thyroid cancer, the rarest but unfortunately also the most aggressive type. Knowing the type matters a lot because it changes how doctors approach treatment. Now let's talk about signs and symptoms. The number 1 red flag, and honestly, sometimes the only symptom, is a thyroid nodule, which basically means a lump in the thyroid gland. If you gently touch the front of your neck and feel a firm bump that doesn't move easily, that's something worth getting checked. Most thyroid nodules are benign, meaning non-cancerous. But if one feels very hard, fixed in place, or starts growing quickly, that's more concerning. Interestingly, painless nodules are actually more worrisome than painful ones. If a nodule suddenly becomes painful, it's often due to bleeding inside a benign cyst, not cancer. But a painless, slowly enlarging lump, that's when doctors start thinking about thyroid cancer. Other symptoms can come from the tumor pressing on nearby structures in the neck. For example, hoarseness or changes in your voice can happen if the tumor irritates or presses on the vocal cord nerves. Difficulty swallowing, called dysphagia, can occur if the tumor is pushing against the esophagus. Some people notice trouble breathing, especially when lying flat. That's because the growing thyroid can compress the windpipe. And in very rare cases, if the tumor grows into nearby nerves, people might develop something called Horner's syndrome, which shows up as a drooping eyelid, a smaller pupil, and less sweating on one side of the face. Sounds dramatic, but it all comes back to pressure from the tumor in the wrong place. Swelling in the lymph nodes of the neck is another important sign. Think of lymph nodes like security checkpoints in the body where immune cells gather. If cancer spreads, the first stop is usually those nodes. So, if someone notices firm lumps in the side of their neck along with a thyroid nodule, that definitely raises suspicion. Now, before we keep going, if you're finding this breakdown helpful so far, do me a quick favor. Hit that like button and subscribe. It really helps the channel reach more people who might be looking for this information. And feel free to share this video with friends or even in your study groups if you're a medical student. Okay, back to symptoms. Some types of thyroid cancer, particularly medullary thyroid cancer, can cause unusual symptoms like frequent diarrhea or flushing of the face. That happens because this cancer can produce hormones or proteins that affect the gut and blood vessels. And like many cancers, thyroid cancer can also cause general constitutional symptoms. Things like unexplained weight loss, fatigue that doesn't get better with rest, night sweats, or even low-grade fevers. These are less common in early thyroid cancer, but more likely if the disease is advanced. So, how do doctors diagnose thyroid cancer? Usually it starts with either the patient or a doctor noticing a lump in the neck. The first test is typically an ultrasound of the thyroid. Ultrasound is great because it shows the size, shape, and texture of the nodule. Certain features like irregular edges, tiny calcium spots, or increased blood flow inside the lump make doctors more suspicious. If the nodule looks concerning, the next step is a fine needle aspiration biopsy. This is exactly what it sounds like. A very thin needle is used to collect cells from the nodule, which are then looked at under a microscope. It's a quick procedure, usually done in the office, and provides crucial information about whether the nodule is benign or malignant. Blood tests are also used, especially for medullary thyroid cancer, where doctors check calcitonin levels. And in some cases, a CT or MRI may be done to see if the cancer has spread beyond the thyroid. All right, let's talk treatment. The mainstay of thyroid cancer treatment is surgery. For most patients, doctors remove either part of the thyroid, called a lobectomy, or the whole gland, called a total thyroidectomy. If lymph nodes are involved, those may be removed too. After surgery, many patients need radioactive iodine treatment. Here's how it works. Thyroid cells, including most thyroid cancer cells, love iodine. Radioactive iodine is swallowed in capsule or liquid form, and it specifically targets and destroys any leftover thyroid tissue or microscopic cancer cells. Think of it like a heat-seeking missile that only locks onto thyroid cells. Pretty clever, right? After treatment, most patients will need lifelong thyroid hormone replacement, usually in the form of levothyroxine pills. This not only replaces the missing hormones, but also helps suppress TSH, a hormone from the pituitary gland that can stimulate cancer growth. For more aggressive types like anaplastic thyroid cancer, treatment is more challenging. Surgery may not always be possible, and doctors may use external beam radiation, chemotherapy, or newer targeted therapies that attack specific genetic mutations in the cancer cells. In fact, as of 2025, there are exciting new drugs called kinase inhibitors being used for advanced thyroid cancers, especially those that don't respond to standard therapy. Immunotherapy is also being studied, although it's not yet routine for most thyroid cancers. So what's the outlook? The good news is that most thyroid cancers, especially papillary and follicular types, have an excellent prognosis. In fact, the 10-year survival rate is over 90%. Medullary thyroid cancer has a more variable outcome, depending on whether it's caught early and whether it's genetic. Anaplastic thyroid cancer, unfortunately, has a poor prognosis, but research into new treatments is ongoing. All right, let's wrap this up. Thyroid cancer may sound scary, but in most cases, it's highly treatable and often curable, especially when caught early. The key takeaways are this. If you notice a lump in your neck that's firm, painless, and persistent, don't ignore it. Get it checked. If you have symptoms like hoarseness, difficulty swallowing, or swollen lymph nodes, those are also red flags. Diagnosis is usually straightforward with ultrasound and biopsy, and treatments like surgery and radioactive iodine are very effective for most patients. And remember, staying informed is one of the best tools you can have when it comes to your health. Thanks for watching. If you learned something new today, make sure to like this video, subscribe to our channel, and share it with someone who might benefit. Take care, and I'll see you in the next lesson.